Hello, everyone. My name is Mark Kageyama, and I'd like to welcome everyone here from all over the world to be your own hero. And I'm a stage 4 prostate bone and lung cancer patient, been dealing with cancer since late 2020, early 2021, and doing very well. And I'm so happy because my test results have been really, really good. And so, yeah, there's so much to share with everyone here about things that are going on. But when things start happening that I can reveal, I'll let you know. But I am so excited today to have an amazing person on, Lisa Verhaeghe, and she's from Florida. And so what I'd like to do is bring her on. Lisa, please share a little bit about who you are and your story. This is going to be great. So, Lisa.
My name is Lisa Verhaeghe. I grew up in California, and I had actually reached out to Mark on LinkedIn because my father, who's in his 80s, was diagnosed with cancer. And Mark was telling me about Reiki mushroom powder, and he suggested that I get that for my dad. And lo and behold, a few months later, I personally was diagnosed with metastatic stage 4 cancer of the stomach, liver, and peritoneum. Um, I'm 59, and I have 4 children and 3 grandchildren, and I have a lot to live for. So Mark was kind enough to give me a lot of advice as far as diet goes. I was reading some books on changing my diet. I always thought that I was a healthy eater. I always had fruits and vegetables in my diet. I grew up with us growing the gardens in California, and I did unfortunately have a sweet tooth. So all of my bad eating was sugar related. So obviously, I've learned that cancer loves sugar, and so I have started chemotherapy. My diagnosis was only about 2 to 3 months ago, and they told me that without treatment, that I had about 3 to 6 months to live. So in those 2 months, I went from a doom and gloom mentality to a proactive mentality. I want to change my prognosis, and I want to stick around a lot longer than what they're saying I'm going to. So I've been trying to eat everything organic and cut processed sugar out of my diet, which has been very difficult, but uh, fruits really do, you know, take care of the sweet tooth. And I've been implementing that every day. And I've gone in the last 2 months from doom and gloom to very hopeful. I actually am feeling better than when I was diagnosed. I was having stomach bloating, stomach pains. My stomach would get so big that it even was uncomfortable to walk, and all of those symptoms have gone away.
That
So
is that is awesome. By the way, Lisa, what do you do for a living?
I am a diagnostic sonographer, and actually, by accident, found the cancer myself. I went from patient care in a hospital setting to a new job in an outpatient center where they did an exam that I had not done in the past. So I decided to practice on myself. And when I put the ultrasound probe on my belly, I saw that I had tumors all across my liver. And so that's how my journey began.
So tell us what was your reaction when you actually saw this for yourself? I mean, that is I've never heard anybody diagnose themselves.
Everybody that I talk to in the medical field says the same thing. They're like, I've never ever come across somebody that diagnosed themselves. Um, I've been doing ultrasound for about 13, 14 years. So I unfortunately, I knew what I was looking at. So I cried, I had a meltdown. And then of course I still had to scan the patient. So I had to, get it together. And then I called my primary care physician, and that's when things got set in motion. I had, an MRI, PET scan, I've had colonoscopy, mammogram, a brain scan, just, it just goes on, biopsies. Um, and it's been a lot in a few months. It's been a lot. But um, in those few months, like I said, I went from doom and gloom to really hopeful, and realized that I have to be proactive in my own care. My oncologist actually, my first meeting with her told me, you might not be around more than 6 months. So eat cookies, have ice cream, stop working and just do all the things that you want to do. And I had already been reading before I met with her, and I'm like, eat cookies. So I realized that it's not, the doctors are not the only solution. You have to be your own advocate also, and you have to do everything that you can to educate yourself, to take care of yourself and prolong your own life. Because if you're waiting on the healthcare workers, they're obviously intricate to the process, but they only do their portion. They don't, your oncologist is not a nutritionist, and so they tell their portion, which is going to be medicine based, clinical based. But and they're also dealing with the masses, and the masses unfortunately don't educate themselves, and they just let the doctors lead them. And I wanted to do more than that for myself, because I do want to be around longer than what they're telling me, and I'm gonna fight.
That is so awesome. How did you make the turn from being, discouraged and negative to turning the corner and doing the opposite? How did that happen?
Um, well, I've always said that I want to be somebody that sets a good example, and I didn't want my kids and my boyfriend to see me depressed and giving up, because my kids were very emotional as it was, and me being upset and crying and feeling doom and gloom affected them. um that willpower to want to be more positive for them, was probably the fire, that started me thinking differently. But also the fact that when I did start changing my diet and starting the chemo, that I literally physically was feeling better. Literally feeling better. I mean, I thought chemo meant I would be sick and vomiting and, in bed, tossing and turning with, abdominal pain. And that has not been the case at all, not even a little bit. I actually feel better. My stomach bloating has gone down. My energy levels have gone up. I'm back to doing, cooking and baking and gardening and house cleaning and working and all the things that I did in my normal life before I got the diagnosis.
I am so impressed. I can't even imagine. Lisa, you have continued working through
Yeah.
stage 4 cancer. I mean, I was flat on my back, barely able to walk, and I just admire so much that you've been able to do that. So why don't you share with us how, about that? That is
Well,
incredible.
the first month was not easy, because I was still having the symptoms, and so some days I'd get up to go to work and go, I don't know if I'm going to be able to do this. I just don't know if I'm going to be able to do this. But I do have a 19-year-old still at home, and a 21-year-old, and I'm still trying to help support my family. Their father died in 2014, so I'm it. So wasn't ready or prepared to stop working yet. And like I said, my symptoms have gotten so much better. The belly bloating has gone away, and I am feeling better and more energized. So I'm able to just get up and do my usual routine pretty basically.
That is absolutely fantastic. I just love to hear that. And so now you've turned the corner from doom and gloom. What is your how do you look at life on a daily basis? What is your life like today?
Um, so I actually revel the days that I feel really good. So it's really a daily basis. I mean, I still have sometimes I have abdominal discomfort, my GI tract, obviously, since that's where the cancer is in my stomach and my liver. I still have a little bit of symptoms here and there, but mostly I revel in the days I feel really good. And I find that I feel good more days than I don't feel good. So that encourages me. And, when my friends text me or call me, or my kids text me and call me and say, "How you feeling?" Like, they are so excited for me when I say, "I really feel good. I feel good." I mean, I expected such I had preconceived notions of such worse uh um symptoms, and it just, in my mind, I was my own worst enemy. And so now I get up and I say, "Wow, I feel so much better than I expected. And today's a good day. I feel really great. And I have no symptoms today. How amazing." So it's really great. You do have to live every day. You have to make a conscious effort of what you put in your mouth, which is time consuming. But it's important, and I can feel the difference for sure.
That is awesome. So how have your kids reacted now? Are they, how has that turned? You turned around your attitude and everything like that. How has that been?
Um, so I have two really emotional kids and two stronger kids. The emotional kids, I mean, when they would see me not feeling good, like, they'd be in tears. So when they can see me cooking and doing my regular mom stuff, you know, they feel like cancer's on the back burner. They're still dealing with mom. They're not dealing with a cancer dying person. They still have mom, so it helps them a lot.
That is fantastic. That's what it's all about, isn't it?
Yeah, 100%. Because that's who I'm living for.
That is beautiful. And I have great confidence that you'll continue making it. And you know, when we as cancer patients, we have to face our own mortality and stare
Right.
death right in the face and say, "You're not winning. It's not your time. I'm not going to allow you anything in this cancer journey. This is my cancer journey, and I'm going to beat you." Right?
Yeah, and it's also about feeling good. I
Hmm.
mean, none of us knows when we're gonna die, none of us. If you would have told me last year that I had 3 years to live, I would have, broke down and cried. And now when they were telling me 6 months, and now they said, "Well, the way things are looking, you probably have 3 years." I mean, I was celebrating. So it's a mindset. And in those 3 years or more, hopefully more, I just wanna feel good. I wanna enjoy my family. I wanna enjoy my days. I want to, live life to its fullest, do all the things that I love doing. And, so instead of looking at dying, I've changed it to looking at feeling good. Like, I just don't want to feel bad. So I don't really focus on the dying part like I did in the beginning. I focus on the, I want to feel good.
And what's beautiful is you're living, and that's what it's all about. Is so many people, when they get that cancer diagnosis, they build their life around that diagnosis. The doctor tells you you have 6 months to live, and they start building their life around 6 months. And you've got to go way beyond that. You got to say, you're not God, you're not
Right.
you're not in charge of me. You don't even know me. Uh, I mean, the medical system, oncologists and doctors, they only get 15 minutes with each patient. They're on a tight schedule. They're always running behind. And so how in the world can a doctor get to know you in 15 minutes? They don't know your spirit. They're not
And they
adjusting for that.
and they're comparing you to hundreds and hundreds of other patients who don't have your body and who do not have your cancer and who do not have your, I mean, some people have diabetes, some people are elderly, some people have high blood pressure, people have obesity. I mean, everybody's dealing with their own other issues on top of the cancer. So it's really hard for me to clump myself in with the masses because I don't fall into a lot of those categories. So I started realizing, yeah, that's across the board, but I'm not across the board. I'm not across the board. I'm my own individual and I have my own health strengths and also, again, knowledge, realizing that I was hurting myself with the sugar and that I could do better, and change to organic foods and organic meats and just eat. I thought I ate so clean, but I realized I really wasn't eating as clean as I thought I was.
Isn't that the truth?
Yeah,
I thought I ate great
me too.
until I got cancer.
Yeah.
But then you have to come to the realization, if my diet is so great, why is this cancer here?
Yes.
And that's a hard reality to face, right?
Yeah. Especially when you think you're doing so good.
Right, exactly. I thought I was doing so good. And yet you have to come to the reality about your diet and
Yeah.
be willing to change things in your life. And so many people are not willing to do that. Uh, a question that I asked you when we first started talking, we've had several conversations. The question that I asked you was, how serious are you about living? And what did you tell me?
Right. Very serious. Like I'm on board. I Whatever I have to do, whatever changes I have to make, however disciplined that I have to be, because that's what it is. It's discipline. It absolutely is discipline. I miss chocolate like you have no idea. I miss it. I miss it. I miss it. But you find alternatives. Strawberries are wonderful. I'm enjoying fresh squeezed grapefruit juice and fresh squeezed orange juice, and those bring me a lot of pleasure. Not as much as chocolate, but I'm learning to adapt. So, and knowing that I'm doing this for my body, it definitely gives you the will to be disciplined. It drives you. It definitely does.
It's just a matter of making these changes a habit, and then you don't think about it. I don't even think about, the things that I do, and it's just the things that I do, and these are the things that help me on a daily basis. I still do my original diet. I've changed, altered some things, but I still do my diet every single day, and it's important to me. And it's the things that have helped me get better. In fact, when I saw my oncologist a couple of weeks ago, when I started with her, my PSA was 986. And with my appointment a couple of weeks ago, that number, and it should be under 3. My number is now down to 0.3, which
Unbelievable.
it's just mind-boggling. And she has
It
no answers. She had no answers for how that happened. But one of the things that really helped a lot is, like, I'm a huge blueberry fan. I just love blueberries. And I just keep eating them and eat tons of blueberries, and just because I like them, without realizing how much it's really helping my prostate get better. So you find these things, and you start really liking them, and
It's
and, and so you don't even think about it. I mean, I used to love eating, the lobster and crab and all that kind of stuff, and you don't miss it until you see it and you smell it. And we're human beings, and we smell things and we see things, and these are the things we're used to. But as cancer patients, we need to substitute and accept. And the only time I really miss them when I go out to dinner and I see people eating them, and it's okay. I'm happy that they're enjoying it while I am eating whatever I choose that's more healthy. So, but I am so excited for you, and I'm so happy that we've met. And
me too. Well,
yeah.
you said something to me that really stood out in one of our conversations. And you said that people ask you about like a cheat day or a cheat meal, or something like that to look forward to. And you said, well, yeah, if you're willing to cheat your own body, then then have your cheat day, but you're cheating yourself. And I thought that was so profound, because you're right. I mean, so I could be doing so good, so good, so good, and then I'm gonna have a cookie, and then what am I doing? I'm trying to shrink my cancer, and I'm trying to not feed it, and then I'm gonna have a feeding frenzy for it. It doesn't make sense. It just, you don't want to undo the good that you're doing. That's my feeling, is that you don't want to undo the good that you're doing. And if I'm starving the cancer, then I don't want to spend a day feeding it.
Right. Absolutely. Because cancer feeds on processed sugar. I know people that have looked at cancer under a microscope, and they've seen cancer actually feeding on processed sugar, and that's what it feeds on. So why would you want to feed something that could kill you? It does not make sense.
Exactly. Yes, exactly. And that is definitely how I look at it. That's exactly how I look at it now. I mean, I miss cookies because I am the cookie monster. That was my treat of choice. But yeah, why would I want a cookie if it's going to make my cancer grow and thrive?
Right. And you always have to keep your life in perspective with what you are putting in your mouth.
Yes. Yes. So, you are way ahead of me as far as diet goes. Again, I actually found the cancer in the middle of June. So that's how early we are on in this process. So, from June to now, which I guess it's been about 2 months, then exactly, I've lost about 15 pounds just in the diet change. So I'm still trying to learn ways to have more substantial food besides obviously fruits and vegetables and chicken and meats. Um, so what would you suggest as far as carbs go, and higher calorie higher caloric foods that are still healthy and non-cancer causing?
Well, I try to limit my carbs. I do have some carbs on occasion, but I try to limit those because those are, uh,
Turn to sugar.
yeah, yeah, exactly. Because carbs can convert to sugar. So you don't want that, so you can limit that. But I mean, there's so many things you can eat, and that's kind of like a we'll save that for another day, because that's such a broad thing that we could get into, and we could always shoot another video on that one. In fact, what I'd like to do is invite you back, if you accept, to do another video down the road, because you're at the beginning of a journey, but
Yeah.
you're going through the process, and you're doing all these things that are helping you. And so I want to bring you back, a month or two down the road, and see how you're doing. And I love your spirit, and I know that your kids have to be loving seeing their mom just fight.
Smiling again.
Yeah, I love hearing that. Absolutely love hearing that. And I mean, I just love your story. And I have so many people that come to me on a daily basis, and it's crazy to me how many people are not willing to fight, and really, really fight for their own life. And they just give it all to the doctor and say, hey, doc, whatever you do, I'll do whatever you say. And, just leave it at that. But that's not enough. I mean, this is a battle. This is a fight for your life,
Life. For
for
your
your
life.
life. And
Yeah.
people don't realize the extent that they need to go to save themselves. You have to advocate for
100%.
yourself.
Yeah, like I said, my oncologist said, eat cookies. Eat cookies, eat what you want, enjoy, you want to keep your weight up, and you want to just, you don't know how long you have, so just indulge, and I thought, that's the opposite of what I'm going to do. I'm not following that advice, not even a little bit. Like, she thinks the chemo is going to be my saving grace, and it's going to give me X amount of time, but if I do the chemo and the diet, it's going to just give me longer.
And this is, you're somebody in the medical field, and you're, deciding to do this for yourself.
Yes.
I love that. Absolutely love that. What is your final thought that you'd like to leave our audience for today? Because we will continue this down the road.
I think that my final thought would be to be your own advocate. Don't give up, and don't listen to everything that they tell you, the oncologist, or what you read. Because I started going on the internet and reading, and I was just as discouraged as could be. And just concentrate on what you can do to preserve yourself, and educate yourself. And diet is way up there. I mean, diet is so important. And like I said, just changing my diet, I feel better. I feel so much better. So and that's what it's about. My goal is to feel good as long as I can, and I'm feeling good. So
Truly, truly awesome, Lisa. I am so thankful and happy that we have connected. And you know, I know that we're going to be friends for life, and share your journey, because you will get better with your attitude and what you're doing. And I have great confidence in that. Again, I'm not a doctor. My diet, I'm willing to share it with anybody, but this is what's worked for me. And that's all I do, is I share it with people. And this is something that people need to do for themselves. I'm not
yeah.
selling anything. I'm not saying, hey, you have to do this. I'm not saying that it'll work for you. This is what's worked for me. And I'm so happy that you have shared your story with us. And I appreciate you being here. And we're going to continue this conversation down the road.
And this journey. And this
Yes,
journey.
absolutely. And I just loved hearing what I heard today. And so I'd like to thank you so much, Lisa, for joining me. And by the way, Lisa is my older daughter's name, so I have a special affinity to you and your name.
Thank you.
Thank you so much. And I'd like to thank everybody here for joining us at To Be Your Own Hero. And I'd like to leave everybody with a couple of quotes. And these are from Dr. Norman Vincent Peale. And the first one is, never forget that all the enthusiasm you need is in your mind. Let it out, let it live, and let it motivate you. And the second quote is, dare to be what your best self knows you ought to be. Dare to be bigger human being than you have ever been. And that's what you're doing, Lisa. And I absolutely love that. Thank you so much for joining us here at
Thank
To
you for having
Be
me.
Your, oh, I loved it. Thank you so much for joining us here to Be Your Own Hero and make the most out of every single day, which is what Lisa's doing, because life is precious. Life is so awesome. And don't take it for granted. Every day is important to me, and I try to make the most out of every single minute because it's so important to us as human beings, and help make somebody else's day, because that's the way that this world will get better. And we all need to come and share and help our fellow human beings with their lives. So many people are struggling. There's so much going on in our world that it's going to take all of us to come together, band together as human beings. You know, this cancel culture has got to stop. We need to support each other and help each other and help make this world a better place and love each other. So I think that is so critical. So once again, thank you for joining us at the Be Your Own Hero. Please subscribe to the channel, make a comment in the comments section, like the video if you liked it. If you stayed this long, you probably did. So thank you so much. And we will see you next week on To Be Your Own Hero. Thank you so much, everybody.